right, you ready? Miss Amy, you ready?
Yes.
Okay, so as you know, we went from the left groin.
Hold on a sec, we'll just hold this up quickly.
Yep. So we went from the left groin, and Miss Amy had May Thurber syndrome. We did about an 85% narrowing of her left common iliac vein, and we stretched you to 16. Didn't respond at all. Put a 1480 stent in there, and we stretched you, and we had a great result. So all the collaterals that were present, side streaks avoiding the traffic jam, are now straight through piping because of the stent. We checked your right side of your pelvis, that was normal. The right kidney was normal. On the left side, I saw all kinds of heavy azygous collaterals, so that's why we checked the left kidney. And you were 50% narrowed, and we stretched you to 14, which is probably a standard size balloon in both locations for women in these locations. When we went to your azygous, you had the history of the hugs, right?
Yes.
And we found all kinds of stuff. Really severe web, you'll see right here on your pictures. It's like if someone took a rubber band around a long balloon and just put a real tight drawstring on it. And we stretched that to 8 up top, and we stretched you to 6 along the vertical portion. So it's very, very tight up here, 85%. So once we injected the azygous after we treated, all those collaterals resolved and excellent result.
So this is the azygous right here.
That's the azygous.
Okay.
And you'll see the projection. Everything else will be kind of straight when we do the imaging except for your neck, but you'll see this one's turned to the side because it goes off posteriorly.
Okay.
And you'll see, because you're thin, it's very tight curve. It's like a 180-degree turn.
Wow.
So it'll be easy to see the azygous. And then we went up to your neck. Remember the side they said that was normal before? You had a 50% narrowing at J1. That's at the valve on the right side. Stretching to 16. It's pretty standard sizes, 14 to 16 for women. And we got you 16. On the left side you treated before, also 50% narrowed, and we stretched it to 50%. She had a resistant lesion, and that's why we had to use the second wire. It was really a lot of pressure. You felt it. When we were dilating it, we couldn't get the red one to go up all the way. So I put a second wire next to the existing wire and used that almost like a razor blade to cut. And I got a great result.
So how long is that going to be sore?
I would be surprised a couple days. I would take ibuprofen, 400 milligrams, that's 2 pills, 3 times a day with food,
Okay.
as needed. Okay. So let's talk about you since you're bionic, right, with your stent. I'd like to see aspirin and Plavix for 2 months. So baby aspirin, 81 milligrams, and Plavix, 75 milligrams, 1 per day each for 2 months. And then I'd still like to see you on Plavix long term because of your stent.
Okay.
Okay.
Great.
Complications from those drugs can be bleeding. So if you're brushing your teeth and you see blood in the sink, it's too much drugs. We're going to give up the aspirin first.
Okay.
Or bruising that you don't remember getting hit. It's too much drugs. We'll give up the aspirin as well. I'd like to see you go with just the Plavix if that happens, but you have to gauge yourself. If it's still too much drugs, you got to say, I'm taking too much. Okay. The fish oils and everything that you're taking will thin your blood, but not enough to make the bruising happen. Okay. That's the scoop. I want you to know that I'm a big fan of you knowing your body, and I'm not a big fan of getting annual MRBs or abdominal ultrasounds. Trust yourself. You're already an outlier, so in my opinion, you're already in that 80% category for back, right? You're already at 80% responder. So my logic is follow your response. And if you're fine, you're fine. And if you're not, well, then that might warrant further investigation. But I tell all my patients, take a step back, the 10,000-foot view. You have to dissociate MS from life, okay? Because there's bumps and bumps and valleys of the life, right, road, and you have to dissociate that from MS. So you kind of, I encourage people to take write a log. How are you doing this week? And then after 4 weeks, how am I doing this month? And then month by month, and then you'll have a hard copy for reference. When I look in the mirror, I'm like, am I the guy from high school? Maybe I recognize my eyes, but I don't remember the day-to-day changes, you know? And a log keeps you a fixed reference, and then you can check and see how you're doing. And don't forget, you're in that golden period of the 6 months, so rehab, that's for me, right? Strength and conditioning, 6 months, okay? And you're set then.
I'm set then. Is there anything that you can say that might help us in Canada to move things along?
Trust your patients, Canada.
You know what? That's great.
Trust your patients. Trust Sandy McDonald, you know. Trust, Mark Hakey, who's Canadian, who's in Detroit, Trust Zamboni and Hubbard, who have gone up to the Canadian government in Ottawa lobbying for you. Who's that great lady?
Kirsty Duncan.
Yeah, she's awesome too.
Yes,
I mean,
she is.
she's a scientist, you know, and for her to put her neck out, I mean, that's fact-based, you know? And do we have enough trials? Absolutely not. That's why we enrolled in the Hubbard trial, you know, and the Hubbard registry. That's a big deal. But our data will bear this out.
Are you working on anything else?
I am.
Registry-wise?
I am.
Nothing you can disclose yet, I guess?
No, I mean, I just...
Have you hit any other illnesses? Like, I know some are reaching out to Parkinson's.
We treated Parkinson's.
Alzheimer's,
There's been some patients with chelation issues, like toxicity issues, that they can't get the heavy metals out of the brain, so we can do that. It's interesting though. I had a fibromyalgia patient just the other day, but not enough data. Not enough data to hang a hat on it yet. But it's patients that are interested in being treated for other.
So you don't turn away the other diseases.
I'm fascinated to find out. I mean, if we turn away MS patients in the beginning, we'd have no data, right? So I'm a big advocate of seeing where this goes. And I still think the therapy's in its infancy. You know, if we can do the same results with low pressure, I think that'd be a great thing in the long haul. Because it'd be less barotrauma and less, restenosis. So we have to really keep our eye on how we can minimize the side effects. But we're excited.
Do you go in the femoral vein or the one next to it?
Yeah, we went in the femoral.
The left, yeah.
So we had a great result.
Yes.
Gotta be happy. Okay.
That's what's done.
So big point though for me is trust your evaluation of yourself. It's a rare MS patient that doesn't know their body way better than anybody else, right? So.
The webbing you were talking about up here.
About.
Oh, I guess I say that funny too, right?
Because you're Canadian.
You and 4 people today.
How do you say
We
it?
say about, right?
About?
We all
Forget about.
We all chuckle, you know.
Okay, now I get it. You didn't mention that before, and I didn't pick up on the joke.
It's from Saturday Night Live, and they white north and all. Hey, Ozer.
The webbing. Okay, can you explain again?
You know what I'm saying?
Yes, I do. I grew up right down there in the corner.
Hey, Ozer.
The webbing. What is? You said it looks stringy. I'm just trying to understand what you.
A webbing's almost like a diaphragm, almost like a washer. If you've got a nut and you have a washer over it, it's real thin. There's still a hole in it, right? But it's just there. And what we do is disrupt the web by tearing that inside that washer so more flow can go through the hole. It's almost like I took a hose and I took a real tight string in the right spot, just tightened it down. So it's real tight in one spot, but the rest of the hose is normal size. And we break that so more flow can get through. It's all about loving.
I feel like I've been, like something's been done.
Yeah.
Well, usually the red face is a good sign, and she's got the red face. You see her face? Do you see how she's pinked up?
Pink cheeks.
She's got pink cheeks, and that's usually a good sign.
Oh, okay. I guess, were they white before? I don't know. Were they white before?
Yeah.
Yeah?
Yeah, it was usually a paler and then pink.
Yeah.
Did you notice anything like feet or hands or anything?
I'm
during-
warmer. Remember, hands were really cold before.
you are
Or have you
warmer.
just warmed the place up?
I don't know.
Because it was very cold.
The other
out
one was
there.
ice. Look how red it is. Before it was all white.
Yeah, you're right.
Look at that.
And I haven't just come from Greece.
You remember how white it was?
I know.
Oh, you were just in
Greece.
Greece? Whereabouts?
I was in Athens, but for the taxi strike.
I
They're on
went
strike
to,
again
I went to
today.
Crete.
Get these guys on.
The week leading into Memorial Day.
Oh,
I was in
wow.
Crete.
It's
My
crazy.
daughter was on
Pretty,
there.
right?
There's none of that trouble down in Crete.
There's no trouble at all.
Not like in the mainland, no.
Well, this is great. This is great. This is great. Now, if we have questions?